Hello and welcome to this webinar on Manganism. If we haven't met before, my name is Danica Harrier. I'm an occupational health consultant with WisCon. I also coordinate 2 additional projects for our group. If you're unfamiliar with manganism, it is a disease that results from excessive exposure to manganese. It's important to note that manganese is an essential element for humans. We ingest it in our diet. Chickpeas, brown rice, pineapple, oats, soybeans, and many more foods contain it. Most relevant to us, however, is that exposure to manganese frequently occurs within the workplace. Occupational exposure to manganese occurs through multiple avenues, including metal hot work, such as welding operations, torch cutting, and lasering. Manganese exposure occurs during these metal heating processes because manganese is present in most metals. It is necessary because it increases metal hardness, it increases the workability of the metal at high temperatures, and also prevents oxidation. Persons who perform metal hot work are exposed to various levels of manganese, depending upon the composition of the metal being worked on and the composition of the stick, flux, or wire. Other factors such as duration of hot work, employee head positioning during the hot work, and whether or not an employee is using and properly using local exhaust ventilation all influence exposures. If employee exposures to manganese are not well controlled and employees are overexposed, they are at risk of developing manganism. In the earliest phases of manganism, a person may experience mental health effects, such as heightened irritability, a lack of interest in things that used to interest or excite them, increased aggressiveness, hallucinations, and psychosis. The next phase affects short-term memory and computation ability, meaning that a person's ability to critically think or problem solve is limited. Manganism identified at either of these phases is potentially reversible. The last phase of manganism is the most devastating and is similar to Parkinson's disease. Symptoms include loss of balance, uncontrollable tremors, slow and clumsy movements, face spasms, speech disturbances, rigidity, and gait or walking abnormalities. Manganism at this phase is irreversible. There is no known treatment. A welder is no longer able to perform work as a welder, and every aspect of life is affected. This is a set of MRIs taken of a manganese-poisoned ape. The bright white regions at the central part of the brain are masses of accumulated manganese. These accumulations are in the globus pallidus in midbrain, which influence motor control. This explains in part why motor functionality is impaired in persons who have manganism. You may be questioning at this point whether or not manganese is a problem at your facility. To make this determination, air monitoring is necessary, whereby persons who perform metal hot work are equipped with air monitors to determine their daily dose to manganese. Persons whose doses exceed the recommended limit of 0.02 milligrams per cubic meter of air are at risk of developing manganism. WisCon performs this monitoring frequently for companies, free of charge. If manganese exposure is problematic, we also assist in making recommendations to reduce exposures, which reduces the risk of employees developing manganism. To summarize what we've learned, manganism results from excessive exposure to manganese. Manganese exposure can occur in the workplace, particularly when metal hot work occurs, such as welding. Manganism is a neurological disease, the last phase of which is irreversible. Air monitoring can be used to assess employee risk.